today, my topic for today is Crohn's. I did a topic on irritable bowel disease. And so this is one of those diseases. And so I'm just going to go into more details about this, as this is Crohn's disease month. So what is Crohn's disease? So Crohn's disease is a chronic, lifelong autoimmune condition that inflames and irritates your digestive tract, most commonly your small and large intestines. Crohn's disease is one of the most common forms of inflammatory bowel disease. And this is what the intestines look like when someone has Crohn's. So what causes Crohn's disease? The exact cause of Crohn's disease remains unknown. Previously, diet and stress were suspected, but now doctors know that these factors may aggravate but don't cause Crohn's disease. Several factors play a role in its development: the immune system and hereditary. So what are the risk factors? Some of the risk factors are age. You get Crohn's disease at any age, but a large percentage of people are diagnosed in their late teens to early 30s. Genes. If you have a biological parent, sibling, or another family member with Crohn's, you may be at an increased risk of having it as well. Location. People living in developed countries and urban areas have a higher risk than those living in less developed countries and rural areas. Now, appendectomy is when somebody had their appendix taken out. Studies suggest that people who have had an appendix surgery may have increased risk in Crohn's. The reasons are unclear, but you still shouldn't avoid this life-saving surgery if you need it. Ethnicity. Although Crohn's disease can affect any ethnic group, whites have the highest risk, especially those of Jewish descent. However, the incidence of Crohn's disease is increasing among Black people who live in North America and the United Kingdom. Crohn's disease is also being increasingly seen in the Middle Eastern population and among migrants in the United States as well. So what are the signs and symptoms of Crohn's disease? Symptoms may develop gradually or come on suddenly. They may be mild or severe. Some people have chronic symptoms until a provider successfully treats them, while others have symptoms that come and go. A flare is when symptoms are active. So common Crohn's disease signs and symptoms include abdominal pain or cramps, chronic diarrhea, watery stool, loss of appetite and weight loss, bloody stool, mouth ulcers or pain in the mouth or gums, fever and fatigue, tiredness that doesn't improve with rest, abscesses or infections around the anal canal. Other signs and symptoms? Crohn's can also cause symptoms in body parts outside of your digestive tract. That includes arthritis or joint pain, rashes, eye inflammation, such as uveitis and episcleritis, kidney stones, osteoporosis, skin tags, usually around the anus, and inflammation in your bile ducts. Crohn's disease in children can cause growth delays or failure to grow properly. So how is Crohn's disease treated? There's currently no cure, again, for Crohn's disease. The healthcare provider will work with you to find the right treatment so that living with Crohn's is more manageable. Anti-inflammatory medications are used, sometimes antibiotics, anti-diarrhea, pain, even steroids. Immunomodulators, biologics, small molecular advanced therapies, surgery may be needed as well, and nutrition is definitely discussed as well. So when they're having surgery, some of the surgeries, they may have to do abscess drainage, they may have to repair a fistula, they may have to get an ileostomy, which is a bag that is used attached to collect stool, and that rectum is closed. A proctectomy may be done. Resections may have to be done, and a colectomy may have to be done as well. So what are some of the complications of this disease? Crohn's disease can cause complications that may require more treatment or possibly surgery. It can cause abscesses, anal fissures, fistulas, bowel obstruction, malnutrition, and anemia. Crohn's disease can also increase your risk of colon cancer and blood clots. So how can I ease symptoms and reduce Crohn's disease flares? You want to avoid medications that can trigger flare-ups. These may include NSAIDs, so non-steroidal anti-inflammatory drugs, like Motrin and those things. Avoiding foods that may trigger unwanted symptoms. You may need to avoid dairy, especially if you're lactose intolerant. Avoid carbohydrate beverages. If you have a stricture, your provider may advise you to avoid fiber. Eating foods that work for you with meals spread out. So instead of having 3 large meals, having small, frequent meals, right? Choose low-fat foods and drink plenty of water. Avoid having caffeine and alcohol as well. Caring for your mental health. And this is with any diagnosis that you have. It's important that you care for your mental health. Getting enough rest and exercising regularly improve your overall well-being, as stress and anxiety are normal responses to this diagnosis and just about any diagnosis as well. So with Crohn's, the important thing for you to know and remember, you should call your healthcare provider if you experience blood in your stool, constipation, extreme weight loss, fever, inability to pass gas, nausea and vomiting, severe abdominal pain, signs of the flare-ups, uncontrollable diarrhea, weakness or fatigue, which may be signs of anemia. Crohn's disease flare-ups are unpredictable and can disrupt your daily life. You want to talk to your healthcare provider about the steps you can take to keep the disease in check. With the right treatment and lifestyle changes, you can manage symptoms, avoid complications, and live an active life. Crohn's affects approximately 6 to 8 million people globally. I want to give special acknowledgement to the Mayo Clinic, Cleveland Clinic, Everyday Health, Crohn's and Colitis Foundation for the information that I provided you today. Should you have any questions, please join us in the Zoom room immediately after service. We'll be happy to answer those questions for you. Thank you so much. God bless and enjoy the rest of the service.